Nobody wants to open up their steaks and have a big, nasty lesion, cartilage in the middle of it. That's just gross. It's terrible. Over the years, many efforts have been put forth in the beef cattle industry to make sure that there's a reduced loss from injection lesions. Beef cattle, like all other animals, need vaccinations to help them stay healthy. Most people just really don't understand the importance of giving a proper injection. Any mistake, especially in the beef cattle industry, you're going to lose money. I grew up on a small farm around a bunch of cattle. It was a huge part of my childhood. Made me decide to go into the vet career. Today I'm going to demonstrate the 4 major steps in properly giving a subcutaneous injection using the tenting method. I have a little picture too of what the lesions can look like if you want to pass that around. It's pretty gross. Of course, before starting your steps, you need to make sure that your cow, this guy, is properly restrained. You usually put him in some sort of shoe or something like that. Step 1 would be drawing your product, your vaccination, or your medication into the syringe. Always make sure you have a clean and sterile syringe and needle. These come in many different sizes. This is a 10 cc syringe. Any injections for cattle you want to do in a 16 or an 18 gauge on your needle. Syringes also come, they have like giant ones where you can load up multiple shots at one time. When you're running big lots of cows, it's way easier. So open your needle and syringe. Always want a new one for every shot and every injection given. Looks like this. Be careful not to stab yourself. We're going to pretend this is medication too, because you flip your bottle upside down and you inject. This is going to make it a little bit of a mess. You just pull your injection out into your syringe until you reach the amount you need. 5 cc's is what I pulled out. You'll recap it until you're ready to use it. And you're ready to move to step 2, knowing your injection site. There's different types of injections. IM, intramuscular, IV, intravenous, and sub-Q, subcutaneous. Sub-Q goes underneath the skin. All subcutaneous and intramuscular shots are going to be done in the neck region to protect your carcass. Right here is the angle, the triangle, where you always want to try to make sure to get your injection. Brought some tape. Then tape it out so we can all see it. And again, this is a cow. And you usually wouldn't tape on a cow. This is just to help get the triangle region. You never want to give more than 10 cc's of an injection at one site. And the tape's not cooperating. You can give multiple injections. You need to make sure that they're spaced at least 4 inches apart. If you're giving 2, the best thing to do is give it on one side, then give it on the other. Step 3, tent the skin. Index finger, thumb, go in your triangle, pinch out a piece of skin. Just leave enough space so that when you inject the needle, you're not stabbing yourself. We use the sub-Q injection to ensure that you're getting the product underneath the skin and not into the muscle tissue. When you get into the muscle tissue, that's when you start getting that damage and the cartilage starts trying to regrow and it causes the lesions. So, last step, inject. Pinch, poke, push it out, and you're done. Okay, today I've taught you the 4 major steps in giving a proper sub-Q injection using the tenting method. You draw back on your product, know your area, tint the skin, and inject. No one wants a big nasty cartilage lesion in their steaks. We use these methods to protect our meats and have big juicy tender steaks. I know I like them. You know what they say about beef? It's what's for dinner.
All right.